This morning, New York City is drawing national attention yet again for a health proposal by outgoing Mayor Bloomberg. Officials will vote today on a plan to require flu shots for kids under 5 years old if they're in preschool or daycare centers. Dr. Holly Phillips is with us. Good morning.
Good morning, Nora.
So what's behind this new proposal?
Really, this is the New York State Department of Health looking at numbers. They found that 40% of kids under the age of 5 who are in these settings, daycare, nursery school, preschool, actually get the flu every fall. And frankly, the department is reeling because 4 kids in New York City died of the flu last year. So this is their effort to try and cut down on those numbers in preschool, but also to recognize that children are often the vector of flu for the rest of society. They get it early and it stays in the population.
But this is not just a recommendation. This would be a mandate. Is this a first?
This is not unprecedented, but it is rare. Similar mandates are in place already in New Jersey and Connecticut. We also have to keep in mind these are not the first vaccines to be required. Of course, we give kids measles, mumps, rubella, diphtheria, tetanus, a great number of vaccines. But quite frankly, in terms of vaccine-preventable illnesses, they're most likely to get the flu. So we're really getting a lot of...
Is the opposition, wherever it might be, more about simply, I don't want the government telling me what I should do with my child, or is it about the actual vaccine and its impact?
Charlie, I think vaccines still remain a very sensitive issue. I always say there are 2 things not to discuss at a cocktail party: politics and vaccines.
Or religion.
Or sex.
Yeah. No, okay, sex is fine.
There are a lot of things off the table there. But I will say I think vaccines are still sensitive. There are people who are concerned about possible side effects. The word autism we still hear, despite some of the research. And again, there is also a sense of, should the government tell me what to do? But it is about really protecting the kids.
Well, when I tweeted about this morning that we were going to be talking about this, should you allow the government to mandate flu shots? I had someone raise concerns about they're allergic to flu shots. What opt-outs are there for people who have concerns?
Right. Well, in New York City, there are 2 major opt-outs, and you can get these exceptions through. The first is religious, and the second is medical. So if you've had a history of sensitivity to vaccines or severe reactions, there aren't very many people who have them, but if you can document it from a doctor or, of course, a religious official, if you're opting out for religious reasons, you don't have to take the vaccine.
But bottom line, you think this is a no-brainer. We should be doing
exactly.
this.
That was my question.
I do think most people, in the medical community, myself included, think kids really, really can get sick from this. So can adults. We can really prevent a huge number of illnesses by doing it.
Thank you.